Oh, Eric,
Yes.
where did you go this week?
I went to visit a friend at Yelp headquarters
Okay.
in Midtown Manhattan,
Uh-huh.
and I decided to ask his coworkers if they have any questions for us.
What does your friend do for Yelp?
He's a account specialist. So basically, when you want to advertise your company,
He creates accounts for different businesses for
Yeah,
Yelp.
basically.
Excellent, excellent. Very good. Yeah, we actually have a Yelp account. And, well, in any scenario, I appreciate you going there. And we have 5, 6 questions, I think, right? So let's try to hear the first question and see what we could do.
Hi, I'm Janelle, and I wanted to know, how do I prevent my skin from overproducing oil?
Beautiful, beautiful question. Janelle, una pregunta bastante buena. Janelle está preguntando, ¿cómo puedo bajar una piel que está bastante grasoso?
Ñami,
Una
ñami.
very oily face. So, Alma, ¿tú tienes piel seco o piel grasosa?
Mixta.
You have a mixed,
Yeah. The
dry and oily skin.
Yeah.
Eric,
it's
I think
usually
you're more dry skin.
But when I eat, sometimes it gets oily.
Okay. So, piel grasoso or fatty or oily skin, la mayoría de las veces depende como en 3 o 4 cosas. First one, ¿qué tanto usted lava la cara? Personas que tienen greasy or oily skin no deberían lavar su cara mucho. No deberían. Máximo 1 vez o 2 veces al día. No deberían usar productos que son oily, like oil moisturizers. No deberían usar makeup that has oil content in it. The best thing they
que
could
son
do,
espesas.
exactly. Una cosa que pueden, they could use foundation. Foundation ayuda en unos casos con oily skin. Okay? Foundation ayuda para pacientes que tienen oily skin. They should wash their face once a day with water and soap. Regular soap with no alcohol, detergent, or mixed perfume in it. Neutrogena soap, one of those soaps that I highly recommend, especially for oily skin.
I love Cetaphil.
Or Cetaphil, exactly. Another thing that they could also do is apply witch hazel.
The best.
Okay.
The
Have you
best.
heard
Ese
of
es mi-
witch hazel?
Yo tengo un cutis excelente gracias
¿De verdad?
a que me lavo la cara todos los días con Cetaphil y después utilizo Witch Hazel, lo que le llaman agua maravilla.
Exactamente. So,
Y es fabuloso, y además evita las arrugas.
ajá.
También.
Alma, ¿qué experiencia tú tienes con esto, con witch hazel? ¿Desde cuándo tú empezaste a usar?
Desde pequeña, porque me enseñó mi abuela que utilizarlo como astringente porque no tiene alcohol, entonces te limpia
So, ¿qué
y
haces?
te tonifica.
Para las personas que están escuchando, levantas en la mañana, lava tu cara.
Lavo mi cara y luego me paso un algodón por toda la cara con este Witch Hazel.
Very good.
That's what I put. And then I put some foundation, very light.
Ajá.
Que no
Not
sea
a
muy
oily
espesa,
foundation.
no oily.
Okay.
Que sea bien ligera y importante que tenga protección solar.
Protección solar, otra cosa.
Entonces después un poquito de polvo para fijar el foundation y además de que te ayuda a absorber el aceite de la cara.
Exactamente. So, Eric,
Yeah.
4 things. All right. Don't wash your face too much. Okay. You could use witch hazel. The third thing is avoid oily products. And then also the last thing, remember, avoid oily foods, because also remember, people who usually eat a lot of oily fried foods, usually they have oily skin. Okay. The fifth one, the important one, is people who have oily skin, la mayoría de ellos tienen unos pores bastante grandes. So, mucho más fácil para esa gente a tener acné. Mucho más fácil para esa gente tener pustular acne or follicular acne. I think last time I put a picture of it when we were here. We were talking about skin disorders. Para la gente, esa gente, hay que estar seguro, okay, que disminuyen la nivel. For them, the only thing that they could do is they wash their face with a good product, okay, use the witch hazel, see a good dermatologist. Maybe they could get a good foundation that is not very, very oily, and change their diet. See a nutritionist. it actually helps a lot. A lot.
It
As
does.
far as what they can eat and as far as what they cannot eat.
You can see the results. I will say, cuando cambias la alimentación, within 2 weeks,
Okay.
you start seeing.
Otra cosa te voy a preguntar. Have you noticed que con el cambio de temperatura, con el cambio de calor, hay algún cambio en las personas, en el texture of the skin? As far as in the cold season.
Los poros están más cerrados.
Exactly.
Y en el verano, por el calor, los poros están más
Exactly.
abiertos.
So people who usually have oily skin in the colder season, it usually becomes dry, okay? Because of the severe cold, frosting, the decrease in the temperature. Usually lower the temperature, usually oilier skin becomes more drier. That's why we have to always use a moisturizer for our face, but not an oily moisturizer, okay? I would recommend them a semi-oily moisturizer, but not a really strong oily moisturizer. Something like Nivea, but not a very, very oily Nivea. I would say maybe mild Nivea.
Y yo no me están pagando, pero yo también uso Cetaphil, que también, porque tiene la crema, es que lo usan los cirujanos también, porque it's very good.
It's a good.
You know.
Very good. Eric, what is the next question? Let's go.
My name's Alexander, and I want to know, is there any truth to the having sex with a woman in the pool is not good for her rumor?
It's not good for her what?
Rumor. So basically, él está diciendo que si es verdad que tener sexo en la piscina no es buena para la mujer.
Porque dicen ahí se piensa que por el agua
Sí.
que da infecciones vaginales.
Okay, so again, these are I love these questions, but no, yo no estoy en acuerdo con eso que una persona puede tener actividad sexual en una piscina y le puede dar algún vaginitis o infección en la vagina o un candidiasis o infección de la orina. Hay muchas mujeres que dicen, ¿sabe qué, doctor Omid? Me metió en el agua y me pensó que una bacteria, algo me subió y así me dio la infección de la orina. These are not true, okay? La única cosa que start in the water, especially if it's a chlorinated pool, sometimes it could change the pH, okay? But that's if you are in it for a long period of time, not, dip in it for 10 minutes and you come out. So really there's no research done to see if there's any dangers with women que están nadando en una piscina que está chlorinated por, tú sabes, 20 minutos, 30 minutos, 40 minutos. Hay unas mujeres que tienen el pH un poquito imbalanceado. Esas mujeres son más al riesgo de tener infecciones en la vagina, especialmente. It's the same thing. Tú puedes decir a una persona, is it true that una persona que puede tener actividad sexual y le puede dar muchas infecciones de la orina? It all depends. It all depends. Una persona tiene pH. Well, there are some women that they have their pH that is not balanced because of hormonal issues, because of polycystis, quistes en los ovarios, because of la menstruación, la sangre, la sangre que se baja, le puedo cambiar el pH, vaginal pH. So that what he's saying is a good question. There's not really that much of science behind it. There's not that been much of studies behind it. The facts are that the chlorinated water at times can cause cambios fisiológicos en la vagina que le puede causar algunas infecciones como candidiasis and bacterial vaginosis. But it's not true if somebody, swims in a pool, definitivamente mañana van a tener una infección de la orina. Ahora, tener actividad sexual en una piscina, again, one of those things, it's not because of that sexual activity, it's usually because of the disposition a la agua, al environment, usually, okay? All right? Because there is an introduction with the sexual activity of all the bacteria and all the water that has a different pH inside the cervical and inside the vagina, and that could cause cambios fisiológicos que le puede causar infección. But not necessarily. Not everybody that has sexual activity in a pool, you go to a resort or you go to anywhere. You go to even if you're on the beach. Not necessarily it has to be a pool. There are different changes that can happen while you're swimming Again, that could predispose you, but it's not. This has not been studied. There's no articles behind it. There's no research behind this. These are all myth. Let's go with the next question.
Hi, my name is Jen. Hi, doctor. So I heard that sperm is supposed to be good to clear up acne. Is there any truth behind that?
Interesting. Interesante.
Eric, where do you find these?
They work in a Yelp, you know?
Very good. I'm not going to get into too much details about this question. I mean, I think these are just questions that people read in cosmopolitan magazines and all that stuff.
Y también yo creo que son preguntas que ellos quieren preguntar a su doctor.
So tal vez they
they're
can't.
So shy.
Exactly.
That, you know.
But that's fine. No, there's nothing scientific behind it, obviously. These are not researched. These are not been proven. I think it was probably an incidental thing that something happened to somebody and they saw maybe the acne got better. Absolutely not. It has nothing to do with the protein levels inside the semen. Absolutely nothing. Absolutely nothing. It's not recommended. There is no such a thing. I know that in some part of the world that they actually do have mascarillas. They do masks that does contain, a better behalf seminal fluid. I'm totally against these stuff. Okay, these are stuff that are not done by professional physicians. These are stuff that you tend to find in places where there's really no limitations or there's really no studies, and they just offer these things. So against it, 100%. It's not been proven. These are the stuff that you tend to read in, GQ magazine and Cosmopolitan magazine, and the facials that they talk about, seminal fluid facials and all that stuff has no scientific basis behind it. And I highly, highly recommend if somebody has acne to get help from a dermatologist or come to our office, Manhattan, 516-587-4510. And we could, first of all, we could do a series of blood tests, check your testosterone, check your hormonal levels, check your thyroid level, check your estrogen level, stuff that could cause acne, check an allergy test, the stuff that could cause facial acne. And if everything is negative, then we could do better care. We could do benzoyl peroxide, we could start retinoid cream, we could do Accutane, stuff that usually work, rather than stuff that you tend to read in magazines that you pick up in Penn Station.
Tengo aquí un email, alma@luisnetwork.com para el doctor. Dice, mi novia tiene problemas relajándose. Yo creo que tiene ADHD. Últimamente le está dando dolores del pecho en el lado izquierdo. Los doctores dicen que todo está bien. Creo que es estrés, pero últimamente le están dando muchos ataques de ansiedad y pánico. ¿Qué hace para calmarse? Le he recomendado meditación, pero tal vez usted tiene otro advice.
Ok. Tú sabes, Alma, yo pregunto a ese paciente que nos habla. Porque tal vez podemos ayudar haciendo unas preguntas. So, if you want to give the office phone number aquí del estudio.
Sí, es el 1-844-898-5847. 1-844-898-5847.
Okay. So, ADHD, okay, or what we call attention deficit hyperactive disorder, es una enfermedad que normalmente le da a unos pacientes que son un poquito más adultos. Es un problema que la paciente tiene disminución del focus. They cannot focus on a lot of things. They have the flight of ideas. Quiere decir, Eric está sentado aquí, está manejando el estéreo, pero al rato piensa, ¿sabe qué? Déjame ir a comer hamburguesa. Then after he eats hamburguesa, he thinks about other things. They have multiple flight of ideas. There is not a constant way that the person sits down. These are patients are very hyperactive.
How do they diagnose?
Okay. Difficult to diagnose because there's no blood work or there's no test or there's no MRI scan or anything. These are only diagnosed based on symptoms.
And behavior.
Based on symptoms and behavioral signs. That's it. Hay muchos medicamentos que le dan para para esa enfermedad. Then we have patients. I have probably 100, 200 patients with ADHD in my office. La mayoría de esos they are under the care of a psiquiatra, la mayoría de esos. But remember, hay un parte de pacientes que tienen ADHD and then they have panic attacks and anxiety. Eso es la parte que está difícil de tratar. And I'll tell you why. Un paciente que tiene ADHD es una paciente bastante hyperactive. ¿Ok? So, lo que queremos hacer es poner tanto actividad. We want to make sure que agarramos todo eso energía positiva and we focus it on one thing. So, we give medications that help with focus. We give medications, Vyvanse, Adderall, Ritalin, amphetamines, Provigil. There's God knows how many medication out there. Yeah. One bad thing about these medications, and I tell it all to all my patients, the bad thing about these medications, it could accelerate your heart rate, te puede subir la presión, te puede dañar el hígado, te puede subir los niveles del hígado, te puede, casi puede afectar todos los hormonas, tiroides, todo esto.
Eso no te lo, sabe que eso no te lo dice nada más que en el potecito.
Por esto, I have psychiatrists que me mandan pacientes a la oficina, yo pido a todos ustedes que toman esos medicamentos, que ven a mí o ven a cualquier médico, 516-587-4510, hacen un examen de la sangre. No tomen Adderall o Vyvanse sin hacer un examen de la sangre o un EKG. Mínimo de un EKG. Mínimo. Hay que hacer un baseline EKG para una persona que toma Adderall. We have Adderall 20 milligrams, 40 milligrams, 60 milligrams. Ahora tenemos el extended release. Ahora tenemos XL, ER, all these stuff. We have all this stuff. And I ask, la problema viene allá es cuando esta paciente, ¿ok? Cuando esa paciente está ansioso, toma el Adderall, el sistema pone un poquito más acelerado. Y tú sabes, le pone un ataque pánico.
Claro.
So el Adderall en original le puede peorar la ansiedad.
La ansiedad, claro.
¿Ok?
Claro.
So what's the next step? Tú vas a poner a una persona con Adderall y luego le vas a dar algo para ansiedad.
Sí.
¿Ok? It's reality. Por eso esa paciente tiene que tomar un medicamento apropiado para esta, for his symptoms.
To balance.
I'm not against medications such as Adderall. Yo no tengo nada contra Adderall, Vyvanse, nada. I'm not against it. These are medications that are used. And if they are used in a direction that is recommended, appropriate, le hacen magic. Magic. I have patients that they had failing grades all their life. And the minute they started Adderall, these are brilliant kids.
I've seen it.
Brilliant kids.
Yeah.
So, there are ways that I have lawyers that take Adderall. I have doctors that take Adderall. Yeah. Okay? I have patients as doctors and lawyers that they come to my office as doctor because I cannot focus at work. Yo no puedo hacer el concentración en el trabajo mío sin este medicamento. ¿Y sabe qué? Pues está bien. Esa persona está dañando su vida de trabajo por alguna cosa que podemos arreglarlo. Pero una persona que está tomando pastillas para ADD, la recomendación es, si hay algún cambio, si hay algún dolor de pecho, first thing first, hay que descartar problemas cardíacos. Hay que descartar si ese Adderall está dañando al corazón, causando arritmia, causando taquicardia. Y si los problemas cardíacos ya están descartando, allá tal vez hay que buscar un medicamento que esa persona puede tomar para disminuir la ansiedad y estrés y toma Adderall como indicado con el psiquiatra. Uno de esos medicamentos that I really like is Lexapro or Wellbutrin. Lexapro, very low dose, 20 milligrams, ayuda bastante para bajar la ansiedad y estrés y depresión. Y al mismo tiempo, una persona también puede tomar Adderall. Otro medicamento que también es una clonazepam. Again, I'm not a very big fan of medications such as benzodiazepines. No soy muy bueno porque son adictivos. But, para una persona que le puede dar un ataque de pánico, 0.5 miligramos de diazepam o Valium o clonazepam o Klonopin le puede hacer magic mientras que le da los ataques de ansiedad. And it actually brings down the rates of admission, porque tú no sabes cuántos pacientes tenemos en emergency rooms que se van al hospital y obviamente si hay alguien que tiene dolor de pecho hay que ir al hospital. No, there's no way around it. But these are not really cardiac pains. These are usually anxiety. So that's a good question. Yo le pido, we have 6 more minutes. Tenemos 6 minutos. Cualquier persona que tiene problema, tiene pregunta, we're going to try to help. At least put them in the right direction, mientras que ellos también tienen su médico para que puedan ver su médico también. Let's go with the next question, Eric.
Hi, my name is Phil. How do you cure plantar fasciitis?
Excellent question. Excellent question. Fasciitis plantar es un espasmo en el músculo plantar, músculo de la piel. Okay, el abajo, en el talón. En el talón. Sí,
eso me pasa a mí mucho. El pie se me curva y no puedo caminar. Es terrible.
La mayoría de esa gente. What was it, Phil?
Phil.
Phil, I want to thank you for asking me. Please, when you talk to Phil, when Yelp,
pensé que era, yo siempre salgo corriendo pensando que es deshidratación y tomo agua, pero nada.
Eso normalmente pasa en las mañanas cuando una persona baja de la cama, siente bastante duro la piel. I had a patient yesterday actually with this. Siente la piel bastante dura. Era una señora de 55 años. I've known her for the last 4 years already. Her daughter is my patient. Her other daughter is my patient. So, the problem is the talón, el músculo de talón está bastante espasmódico y es difícil de relajarlo y por eso le duele. These people walk with a limp. Le duele a caminar abajo del talón. Obviamente esa persona va a necesitar algún imaging, X-ray o MRI para descartar algún bone spur, alguna fractura en el hueso del talón o algo así. Y si es negativo, más probable ese es plantar fasciitis. Tratamientos antiinflamatorios, obviamente. Inyecciones de esteroides, a veces trabaja, a veces no sirve. Pero la más cosa que yo he visto que le ayuda bastante es ejercicios que una persona le pueda en la mañana. All they have to do, okay? All they have to do, and this is important. You could just look up plantar fasciitis exercises en la mañana. You grab a kind of a rope, elastic rope. Yeah. You put it on the bottom of your feet.
The resistant band.
And you kind of flex and extend. You pull and push. You pull and push. You exercise the muscle. Or you could do the top of the feet and the bottom of the feet. Agarra el pie así y haces esos ejercicios en esta moción. Ejercicios para abrir como opening and closing. Like you're opening and closing. Eso ayuda para relajar el músculo bastante. Si hacen 20, 30 de esos 2 veces, 3 veces al día, normalmente this muscle relaxes. There are other therapies, también tenemos. We have other therapies. Now we have the platelet-rich plasma transfusion that I talked to a couple of weeks ago. We get the blood and we inject it inside. That usually helps. It's not covered. Cuesta $1,400, $800 a $1,400, depends where you go. The other thing is, shockwave therapy. Shockwave therapy. El mismo cosa que, remember I told you we use for kidney stones? Bam, pa, pa, pa. We use it with the shockwave. It helps to relax the muscle also. So, again, it all depends what doctor you go to, what podiatrist you go to. Come to our office, 516-587-4510. We have a very good podiatrist in the office that we could refer you to. 516-587-4510 for las personas, las pacientes que tienen dolor de la pierna, dolor de pie, plantar fasciitis, espolón, bunion, hammer toes, cualquier problema de pie que tienen, le pueden hablar a nuestra oficina. Eric le va a poner el teléfono de nosotros más tarde en el Facebook con un link, and we could send you, we could put you in the timing, and we could even do same day appointment for you guys. Same day appointment. I always do it. We always do it in our office. You could see the podiatrist as same day. Let's go with the next question.
Last one.
Oh, last question. Where?
Hey doctors, just wondering if anyone's ever figured out what good the appendix is for.
Appendix.
Yeah, ¿para qué sirve la appendix?
Alma, what do you think? ¿Cuál es el punto de appendix?
No sé.
Eric?
La verdad.
Why do we have appendix?
Para que le dé dolor, para que lo saca.
Let me ask you a question, Eric. Where is appendix?
It's like right here.
No. Right there.
Okay.
On the right side. But what is it connected to?
To colon.
What part of the colon?
Large intestine.
Large intestine. Cecum.
Yep.
It's connected to the cecum.
En el cecum no es donde se acumula todo. So que actúa como un filtro, entonces.
No. Ahorita te voy a decir por qué. Cecum so we are talking about the right side.
The right lower
okay.
side.
Appendix está aquí. Okay. es en parte del cecum, okay? You have the ascending colon, tiene transverse colon, tiene del descending colon, and then tiene del sigmoid colon donde está conectado recto y sale la popo. Okay? We good?
Yeah.
¿Estamos bien?
Yep.
So you got the anatomy.
Yes.
Appendix lado derecho. Vesícula lado derecho arriba. Appendix lado derecho izquierda. Hígado lado derecho arriba. Riñones atrás. El colon en el frente. El estómago epigástrico en la boca del estómago. Y el espolón o el spleen. O el vaso, perdón. El vaso. Lado izquierdo anterior. Lado izquierdo anterior. ¿Ok? Anatomy. Básico. So. Good question. What was her name?
Martha.
Martha had a very good question. We still don't know what's the point of appendix. Appendix is a remnant of, okay, es una reminencia de la evolución de los humanos. Desde hace 3,000 años, 5,000 años, when we had the evolution of the human, we had this small portion of the colon that kept getting smaller, 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 and now it has evolutionized into appendix. Appendix no tiene ninguna función interrogativa. It does not. No tiene ninguna función digestión. Nada. Pero, en los últimos años, we're now doing research. Ya sabemos, como a Alma le encantan los probióticos y todo estos, ahora sabemos a los pacientes que le da un dysentery, una diarrea malísimo, una cólera, ¿ok? Y hay una disminución total de la bacteria buena del colon. Appendix tal vez está encargado de producir bacteria bueno y producir en el colon y relajar y descender en el colon. We think one of the purposes of the appendix is production or storage of good bacteria, okay, that usually en los pacientes que le da alguna infección, diarrea, colitis, diverticulitis o algún dysentery donde la paciente tiene bastante diarrea y se pierde muchísimo bacteria bueno de su intestino. Este chiquitito, which is usually around a centimeter, 2 centimeters, usually, this part is responsible to place back the good bacteria in the colon. One of the good reasons for appendix is that. Otherwise, la mayoría de gente tiene appendix. La mayoría de las cirugías que hacemos, apendectomía, una persona puede tener apendectomía. A lot of people say appendix tiene una función linfoide, como tal vez le va a pelear las infecciones y todo, como la amígdala. It's not true. There are cancers that could actually happen in appendix. I want to reiterate. Okay? Tenemos cánceres que son específicos para esta parte, que no son específicos para colon, but specific for appendix cancers, certain cancers, que también hacen secreciones de las hormonas. Okay? So, appendix normalmente no causa nada, mientras que no tiene inflamación. Mientras que tiene inflamación, una apendicitis, hay que quitarlo. Okay? Antibióticos they've not showed any benefits in people who have appendicitis. Usually appendicitis, I know a lot of doctors, and I remember the other day we were talking to Dr. Giancarlo Gomez regarding cuando una persona tiene apendicitis, le va al hospital, they admit the patient. I have a lot of surgeons that they start the patient on antibiotics. It's really not been shown to help a patient. This patient sooner or later needs surgery. They need to do laparoscopic appendectomy. Again, we get the appendix. Sometimes we send it for pathology, all that stuff. Again, a lot of cases we have known that the appendix there could be certain specific tumors that could cause, like carcinoid. Carcinoid syndrome is one of the most common tumors that could happen in appendix. Okay, and it actually produces a lot of serotonins and a lot of hormones. That later on, we talk about it later on. But la importancia es Appendix function, we are now thinking, estamos pensando que la única función que tiene es para producir o para trasladar la bacteria, bueno, después una infección de dysentery o diarrea o un gastroenteritis. Do we have any phone calls? We don't have any phone calls. Very good. So, I just want to do, I know we're a little bit 4 minutes post-op. I just want to repeat a little bit of it, all the stuff that we talked about today. The importance of high blood pressure. Please, pacientes que están escuchando, presión alta ahora es una pandemia en este país. Hay hombres, hay mujeres que tienen presión alta y no saben. They don't know. No tienen ningún síntoma. Presión alta, high blood pressure, is the silent killer in this country and anywhere else in the world. Is the silent killer que le va a matar a todas las personas si no hacen algo. Presión alta es importante arreglar temprano, ya que está tarde, ya el daño ya está hecho al cerebro, el daño está hecho al corazón, al ojo, al riñón. It's late. Es muchísimo más fácil tratar de presión alta antes que está tarde. Los medicamentos, dieta, bajar el peso, fixing everything. Those are the important things. But you got to start one place. And the first place is checar la presión. We have the package. $30. You don't have insurance, no problem. You don't have any information, no problem. Just come to our office one day on a Sunday. Come with family, come to Manhattan, come to New York. Go do your shopping and all that stuff. Pero dice, ¿sabe que quiero ir al doctor Omid para que me chequen la presión rápido? $30. Dile que solo quiere checar la presión alta. $30 para que te chequen la presión alta. Y si está elevado, para que te dan una cita para que pueda ver el médico. ¿Ok? That's number one. Segunda cosa, la vacuna de flu. It's very important. I have a feeling we're going to have a very, very hard flu season this year. It's not really been announced yet. But usually seasons that usually we have a kind of a not a very hard summer. Usually they follow with a hard winter. And it's possible that we have a bad flu season on top of that. That's number two. Number three. I want, once again, I want to thank Luis Jimenez for the show. And I ask everybody to help sign up. Sign up on the station. Go on luisjimenez.com, sign up. And Eric, please, on the morning show, talk to everybody, bring everybody, and recommend them to sign up so everybody can enjoy the show. So that's very important. And I ask all the 4,000 or 5,000 people that listen to this show every week, sign up, help out, sponsor the programs if they need to. And that way we could all have a show that we could produce, and we'll be happy to comment. And the last one is I want to thank Alma. If you have any questions, do you have any emails?
El otro email que había cerrado era acerca de la psoriasis.
Okay, psoriasis. I'll talk about psoriasis for 5 minutes. Psoriasis es una enfermedad de piel. Es una enfermedad típico de piel. Okay. Es una enfermedad que la mayoría de veces no tiene ningún síntoma hasta que salen los ronchas. Los ronchas normalmente son los partes extensores. And the elbow extensores, no flexion. These are the flexion areas. These are the extension areas. Usually extensions. On the back of the arm, on the back of the forearm, on the back of the forearm. Y los rodillas, normalmente. Pero le puede pasar a cualquier lado de la piel. Le puede pasar cualquier. La mayoría de la psoriasis está asociando con ansiedad y estrés. La gente que es bastante estresado. Hay algunas comidas como café, chile, alcohol que le puede producir y empeorar la psoriasis. Tratamiento tenemos, depende. ¿Qué tan avanzado es la psoriasis? Si es una psoriasis fulminante. I have a patient ahora.
Sí, la persona que escribió estaba desesperada. Decía que había estado en tratamiento.
Okay. Tratamientos, the first treatments are usually lotions and creams that we use. Calcipotriene creams, steroid cream, Temovate cream, halobetazole cream, clobetasol cream. These are the treatments that we use. Then we have the pills such as Otezla. There's a lot of new pills out there now. And we have the injections now. So, los injections, Humero is one, Remicade is another one. We have these injections that usually help with psoriasis. Obviamente que esa persona si va a usar inyecciones, hay que estar seguro primero que hace un examen de la sangre completo. Hacen un PPD, examen de tuberculosis. Son inyecciones que no puede usar sin hacer esos estudios. O tal vez el dermatólogo no debería mandar without doing these testing. Obviously, you need a PPD test. If the PPD is positive, you need a chest x-ray, you need a quantiferon, you need blood work, and so on and so on. And he needs to have good follow-up, okay? At least every 3 months, 6 months blood work. These medications are safe. They've been proven to do magic, especialmente los inyecciones, los infusions. The infusions can do a lot of magic, but usually the majority of them, once you stop the injection, can come back, unfortunately. So it's possible that you get the injection y te mejora 6 meses, un año, and the psoriasis is back. Again, these are usually environmental factors too, lo que comes.
Muy importante.
Alcohol, fumar, chile, café, chocolate. These could worsen the psoriasis. But again, it's not a deadly disease, para decir. No hay que perder confianza sobre algo que va a regresar otra vez. It's a disease que tenemos tratamientos and we could control it. So I asked them, y si no tienen médico, en la oficina nosotros, we have a very good dermatologist, 516-587-4510, 516-587-4510, 516-587-4510. We are in the heart of Manhattan, right by 60th Street, Bloomingdale's, and the bridge. It's very easy to find. And we have dermatologists. We have 2 good dermatologists that work with us. 2 good ones. Very good ones. And I'm very happy with both of them. And they are specialized in people who have psoriasis and acne, facial acne, and postural acne and all this stuff. Annular psoriasis and all this stuff. Once again, Eric, thank you so much.
Yo tengo una pregunta más. Yo tengo una amiga que ella es nutricionista. Sí. Y entonces ella me tiene histérica con un afán con que yo me haga una tal prueba de la sangre para ver qué yo puedo comer y qué yo no puedo comer de acuerdo con mi sangre.
¿Qué prueba de sangre es?
Ahora yo no recuerdo, pero es algo como que está muy de moda, que de acuerdo al tipo de tu sangre, lo que tú puedes comer y
como
lo que no
tipo
puedes
del
comer.
sangre, como del
A positivo,
like
o A, Entonces, espérate, let me look into that first.
I've not heard of this.
Okay.
Yo no escuché eso. It's funny, actually, because pretty much we use the type of sangre. Not the major ones are usually no es para ver qué comida tú puedes comer, sin que no comida. It's usually we use it for pre-op purposes, para casos de cirugías, so forth and so on, casos de transfusión del sangre, para casos a hacer trasplantes y todo. We usually use the blood types, cross and match, to give transfusions, all that stuff. But per se, to say qué comida te va a ayudar más con ese tipo de sangre, I'm sure there's a lot of research, there's a lot of studies out there, but it's not really been proven. So I cannot talk about it, pero lo que voy a decir a tu amiga es, espérame a próxima semana. I want to do some research on it.
Yo voy a averiguar si era algún nombre específico.
Es posible que it's not the type of blood work. Maybe it has to do with your sodium level, your potassium level, your magnesium level, your phosphorus level.
No, it was something about
some type of blood.
Yeah.
Okay.
Yeah. That's why I say, okay, wait, let me talk to Dr. Omid. Let me look into
I'm
that.
going to actually look into this for
Okay.
you. Because again, nothing really researched or established in a large randomized trial.
It's like something that is
I think it's something
now,
like that is more of a, tú sabes, kind of a cosmopolitan magazine type of thing.
Pero ella es nutricionista, sin embargo, pero bueno.
I am gonna do my research also. Eric, thank you so much. We are good to go for next week. Espero a escuchar a todos ustedes. Mandan mensaje a Alma.
Recuerden mi email.